It has been tremendously transformational for patients as well as physicians. There have been 2 new releases of medications lately that have taken all genotypes to all oral therapy and usually very short courses. This has happened so quickly because of the dedication of pharmaceutical companies as well as patient advocacy and doctors to bringing this all to market in a very rapid pace. And it has really transformed how we can treat not only standard patients, but special populations. And what has been the most gratifying thing is that special populations such as HIV co-infected patients, transplant patients, not only liver transplant patients, but all transplant patients, and those with decompensated cirrhosis who previously didn't really have access to curative therapy now are seeing truly amazing SVR or cure rates above 90%. The biggest problem with hepatitis C these days is actually finding it. So the hardest part of curing patients is diagnosing them, which is why we're so excited that the U.S. Preventative Task Force has finally recognized that screening for hepatitis C is essential, especially in those baby boomer population patients who are at the highest risk for being infected. And so the big problem we're facing now is that that has not resulted in as many new diagnoses as we had hoped, because good population data tells us that almost 75% of patients who are chronically infected with hepatitis C still remain undiagnosed. Most patients are asymptomatic until they develop symptoms from liver failure, which is really way too late. We can cure these patients now, even with the drugs that are available, which is truly miraculous. However, the ideal situation is to find it early and cure it before patients develop the risk for liver cancer and liver failure. I think the big misconception is that patients had to have used IV drugs and told their practitioner about it before they have a risk, which is why risk-based screening has been attempted and was not shown to be effective. Therefore, cohort screening is the only effective way to approach diagnosing all of the people out there with hepatitis C. I think getting the word out that we now have, usually for most people, an 8 to 12 week course of therapy that is curative 95% of the time and extremely well tolerated with minimal to no side effects, really should improve dramatically the increased rate of screening. Once there was the advent of the molecular structure of the hepatitis C virus, direct-acting antivirals were specifically designed against the targets that are used in the virus to make new virions. And so by specifically targeting different parts of the viral life cycle all at the same time, incredibly effective therapy has been achieved. So HIV Hep C co-infected patients do have more rapidly progressive liver disease than patients who are mono-infected. I will say that patients who are HIV positive are generally screened, unlike patients who are not HIV positive. And so those patients probably are more likely to know about their hepatitis C and therefore be getting in to have these curative therapies administered to them. The advent of all of these medications, as well as their simplification, has truly transformed viral disease treatment. When you're speaking about other types of diseases not based in viruses, I'm sad to say we have not made as much progress. Well, certainly there are more things coming down the pike in hepatitis C that will be even more potent, even easier to administer, and even maybe not even necessarily checking a genotype. So those things are certainly exciting breakthroughs that will continue to evolve in hepatitis C. In other disease processes, certainly we should learn from HIV and hepatitis C that simplification of medical regimens is going to be important to achieve better compliance and outcomes for the future in all disease processes. Many patients cry in the office when you tell them that they have been cured, especially those patients who have suffered through numerous courses of long-lasting therapy with interferon, which for the people who are listening to this know was incredibly toxic therapy. And so to be able to offer these short courses with minimal to no side effects is incredibly gratifying from a practitioner standpoint. I think especially in light of many diseases such as Ebola that are out there that are viral diseases, the fact that in a fairly short period of time tremendous breakthroughs have occurred in viral diseases, it is certainly reason to be optimistic for every viral disease there.